Hi, Sue McCarthy Robinson. I'm going to be talking about a client encounter this week for class MN662. So I'm going to describe, I had a client that expressed some suicidal ideations, feeling that he really, the world would be better without him. So, as the psychiatric nurse practitioner student, I need to address, you know, if a client tells me he or she has some suicidal ideations or any feelings that, life is better without them. So this one of the clients this week, he does have a history of suicide attempts throughout the years. It's been several years that he tried to commit suicide. Definitely through lethal means. He has ingested batteries, sharp objects, cut his wrists before. So knowing his history, I've been speaking with him. He tells me that sometimes a voice will tell him that he's a very bad person, that he would be better off dead and not alive. He's not useful to society, and that he should swallow things, or he should harm himself, with a sharp object, like cutting his wrists. So speaking with him, I wanted to find out what immediate risk he has. Knowing his history and looking at the room that we're in, it's very minimal. His room does not have much of anything in it that he can utilize to harm himself. His trash can does not have bags in it. His remote control, its care plan that it's the universal remote is glued shut. So when his batteries die and his remote doesn't work anymore, just a whole new remote will be given to him and the back is glued on. So I asked him what he does when he has these impending thoughts. He said he turns to his Bible. He has a Bible there. He said, I often call my mom. His mom is elderly in a skilled nursing facility in the state, but far away. And he FaceTimes with her, and she talks him through things. So first, most crucial step, I wanted, to assess his current immediate risk. I asked him direct questions about plans, means, intentions regarding suicide. I needed to determine a specific plan and if he had the means to carry it out. Was this risk impending? I needed to ensure that he was safe, considering, is this at a point, because he's had to have inpatient psychiatric stays. We've had to emergently put a one-on-one on him until he can get through the crisis. So I wanted to create a supportive, non-judgmental environment, which I think was vital. Express empathy, validate his feelings without agreeing with any negative assessments. I needed to let him know that he's not alone and that his feelings are taken seriously. I conducted, a risk assessment that included history, as I mentioned, of a suicide attempt, psychiatric history, family history, current stressors or triggers. This helped the understanding the depth and the context of his feelings. I developed a safety plan that included identifying these triggers, coping strategies, and social support. The plan listed, emergency contact with, within the facility. He needs to reach out to the nurse, the CNA that's on the unit with him if he's having these feelings. Reach out for help. It's important that to review the current treatment plan. I needed to look at do I need to reach out to his psychiatrist? Do we need to adjust his medications? Do we need to increase the counseling sessions that he has? Discussing the effectiveness of the current medications is definitely something to always explore. And is there something else that is needed? Medication, non-pharmaceutical things, alternative therapies if necessary. Is it medical? He does have an extensive medical history. So is there something going on? Do we need some labs? If it's something that's out of the norm that he's going through. So it's definitely necessary to ensure follow-up appointments are scheduled. And as I mentioned, reaching out to the interdisciplinary team, his support on the unit, or other healthcare providers, whether it's medical, whether it's psych, reaching out to them. So continuing this engagement monitoring is crucial, especially after a crisis. So definitely everything that we spoke about, or everything that all the assessments needs to be documented. Decisions made need to be documented, adding to his care plan or his approach plan, behavioral plan, detailed notes need to be added in there so that the continuity of care is there. So I need to provide him and, his mom some educational materials about suicide, its warning signs, how to handle crisis, how to handle stressors, inform them both on, the support group that they have within the facility and outside resources, mental health resources, the counseling, and also include his legal guardian, because he does have a public fiduciary that helps with just the basic needs that he has. Handling such situations requires, a lot of compassion, urgency, professional skill to ensure that the patient feels supported and safe. So there's a lot of emotions, definitely, in responding to what he expressed to me, predominantly empathy, having a deep understanding and compassion for his suffering. This empathy drives the desire to help and support the client through this crisis. A significant level of concern or worry is natural when, especially clients telling you and what they are thinking and how they're going to harm themselves. So, knowing that at that time he was safe immediately, he didn't really have a means to harm himself. I needed to take that responsibility, that feeling, the duty to act efficiently, effectively. I know that, I play a crucial role in preventing, him from harming himself and providing care, which can be heavy, but important burden to carry, as the clinician. Despite any internal emotions, it's critical that I maintain calmness and composure. Displaying calmness can also help stabilize the situation. If I'm going to get all excited, he's going to get excitable. I need to facilitate more effective dialogue and on his feelings and needs. So underlying all these emotions is a layer of professionalism. This maintains boundaries. I need to maintain those, managing personal emotions, to stay focused on his needs and ensuring that clinical decisions are made based on best practices and ethical guidelines. So responding to those feelings that he expressed to me, I need to validate his feelings, acknowledge the pain and distress that he's experiencing without judgment. I need to reassure him that his feelings can be managed and with the appropriate care and support that's always available to him. I'll encourage him to share his thoughts and feelings as openly as possible to better understand and address his needs. So in the areas of the session, you can feel helpless, definitely at times. And, always additional training, is helpful so that I can be the best and bring aid to a client like this I'm sure I'll see again. My emotional response and management play a critical role in therapeutic relationship and navigating the crisis effectively. Patients or clients like him with complex co-occurring disorders such as personality disorders alongside depression or bipolar, which a patient that I'm referring to can present particularly challenging cases that may evoke feelings of helplessness. These situations might highlight a need for the definitely advanced training that I definitely will seek out. And in managing complex comorbidities or specialized therapeutic approaches like individual therapy, what can that do to help him alongside every, a pharmacological need that he may have. Thank you.